Do you make anything of the subgroup between intermediate and poor risk disease here? Bigger magnitudes in the intermediate subset than the poor risk subset?
Yeah, and you would have thought that when you put 3 drugs together, you're helping to rescue those who were what we call our poorest risk groups, those who are most afflicted by their cancer in definition by IMDC criteria. And we just didn't see that. So it makes you think that the Goldilocks principle, right? Are we too hot, too cold, or just right? And maybe 3 drugs in some of the sickest patients was too much to receive in some way. Either way, amongst this trial, it just all 3 drugs. It's not that I don't think they play well together. I think when you administer all of this, it was the first triplet trial at the time, there's going to be some caution and you can just see how much actually was administered. So I do agree that who is that sweet spot? You would think the poorest of the poor, but if they've got like IMDC 6 out of 6 risk factors, how well are they to get triplet? I think is something I would think about.
Absolutely. It totally makes sense. So then I guess in the context of what most people are going to interpret as Cosmic 313 being a negative trial in spite of the PFS median endpoint, I think when we think about clinical practice, most people are going to probably view this negatively. That brings us back to our established backbone of a doublet treatment as first line for metastatic kidney cancer.